Nutrition is a big part, of course, of keeping osteoporosis at bay. And Dr. John is over in the kitchen area, and it looks like he's going to be drinking, right?
I will be doing a little drinking over here, Heidi, but not that kind of drinking. I'm with Dr. David Yang, who's the president and CEO of NutriJoy, and more importantly, he has his PhD in nutritional science. Welcome. Thanks for being on the show. So is calcium supplementation something only that women should be concerned about?
No, actually, calcium is very important for not only women, but kids. As they're growing, they need a lot of calcium because it's important for their bones.
Right.
And I describe it as a bank account. You got to put a lot of calcium away because when you get older, you got to withdraw that account.
You have a lot left to, you need a lot to end up with a lot.
Exactly. And then men, of course, also need calcium because it's important to have good skeletal strength.
Right. Now, what kind of foods do you have out there? What kind of foods are important for calcium?
Well, you know, calcium is found throughout various foods and important in our diet. The dairy group is obviously the most well-known and the highest calcium source, but you can get calcium from vegetables. There's some fruits that will have calcium, but generally they're not a lot of calcium.
Okay, so yogurt yogurt you have out here, and bread and cottage cheese. Now I see people in the emergency department who fall, and kind of seemingly trivial sort of fall, and they break their hip. A lot of little old people, men and women, who are walk over, kind of crouch like that. That's all really related to calcium and lack of it. Is that not right?
Exactly, Dr. John. The big thing is that osteoporotic fractures is actually is a major issue in our health system today. There's more osteoporotic fractures than heart disease and breast cancer and all that stuff. So I'm sure you see a lot of those come through your ER.
And I think what people don't realize is a lot of times these people have a hip fracture. They're not in great health to begin with, and then once they have the hip fracture, they end up getting pneumonia. They spend a lot of time in the hospital. It's just kind of one thing after another. So I guess the key is, you know, prevent the hip fracture.
Exactly, exactly. And that's one of the things that can be easily preventable. Is if you get enough calcium in your diet, those things can be avoided. All right,
now I hope I don't embarrass you. I'm going to ask you a question about vitamin D and calcium metabolism because they're very linked and they're very important. How does it work? Give us a 20-second sort of Reader's Digest version.
Well, not only do you need calcium in your diet, vitamin D is also very important because vitamin D helps absorb calcium. Calcium has to be absorbed by the body in order for it to do any good for your bones.
Right.
So vitamin D is part of that active system to actually help absorb calcium into your body, which then will help build strong bones.
All right. Now you have a new product out called Cal-C. Should everybody be drinking this, or are like the foods like strawberries, yogurt? If you have a balanced diet, do you still need this?
Absolutely. Cal-C is a new product that's out in the market today. It's actually I have 50% more calcium than milk, a full day supply of vitamin C. And it's about half the sugar and calories as regular juice. So it's a very delicious way to get calcium. One of the issues with a lot of the foods here is that there's calcium in them, but you have to have a lot of it. Right. I don't think there's a lot of people that wants to chew on 7 stalks of these broccolis every day to get their calcium.
Never.
So, you know, we know that it's important to get calcium. And so if you have foods and beverages that people will enjoy and want to drink, they're naturally going to get their calcium. And that's what Cal-C does. It's a new juice that people simply love. They love the taste, and it's a great way to get calcium. I know Heidi is already a big fan of Cal-C.
Yeah, actually, you know, I'm not a fruit juice guy, and I had a sip of this, and it was great. Okay, Heidi, I think we're coming back to you. You've had the analysis, or the bone analysis is done. What's the results?
I don't know. I think I need a good shot of Cal-C and a little bit more. It is actually not good news for Betty. Linda, go ahead and give the results to Betty if you can.
Okay. Betty, I'm showing your results. A T-score is a diagnosis, okay? This is determined, and your bone mineral density is determined how much bone loss you have. And I'm showing that you are low average for your age. Your bone density came out. Do you mind telling them on screen what your density was?
It's okay.
Was 0.492, and you should be up about 525.
Okay, so that's osteopenia, right?
Osteopenia.
Okay.
Yes, so that's the start of osteoporosis. It would lead towards it. The good thing is that there are some things that you can do, Betty. One would be some weight-bearing exercises. You can increase your calcium intake, and there are also medications out now that actually build the bone back. So
Okay,
the next
well-
step would be to see her physician.
Okay. Betty, good luck to you. And again, it's the early detection. That's huge, and I know you can definitely do it. Irene and Linda, thank you very much. Okay, we're going to go ahead and move from over here to over here because I'm busy lifting and learning. What do
And
we
I
do
brought
here?
you some calcium to drink.
Ah, man, I need that here.
Yeah.
Salute. Cheers. We've got the buff man, Benny, here. Benny, what is your last name? It's
Bokikio.
Bokikio.
That's a nice Irish name, isn't
Oh,
it?
yeah, absolutely.
Very good.
100%
Right.
Irish.
Anyway, Benny, you're going to put John and me to work, and especially me because I know that for women, certain resistance training is critical in trying to keep osteoporosis at bay.
Yeah, I think a main issue that people don't understand about bones is that they're dynamic tissue. Just like muscles, we can increase bone density. If you're not active, you can decrease bone density. Astronauts lose bone density because there's no gravity up in space.
Interesting.
So yeah, and bones reflect and influence all the major systems in our body. Hormone
Okay,
system.
you're going to show us some exercises because you
Sure.
really work with people who suffer from osteoporosis. You can join in too if you
I'll
want
just
to set the
hold
drinks
the drinks.
That's good, but hold them out here.
Oh, there you go.
right there,
Oh,
and
no.
don't move for an hour. Let them sit on the little ball. Okay, let's start with this
Okay,
stuff. Put me
basically,
to work, guy.
all right, what you want to do is
Set those down.
is
Okay.
we want to tax the muscles that are attached to the bones, and if we increase protein uptake, which is basically muscle toning in
Gotcha.
the muscles, we increase protein uptake in the bone. Pretty simple. Okay.
What do
Heidi,
I do?
Just stand on that deal.
Stand on it. Okay.
For example.
I feel like we need rock music or something.
Yeah. And let's do some basic curls
Okay.
for your bicep.
Oh, curls for the girls. Ah.
No, this is how
Or
I chip
buys
my
for the
tooth.
guys.
Okay.
Yeah, well, it's not supposed to come anywhere near you, so that may be a coordination issue.
What? I'm not messing. What? Just down to here?
All the way down. Okay, that'll be
Okay.
a bicep. Now we can do this if you have enough strength. Let's try to take this out to the side and work shoulders.
Oh, yeah, please. I have good bones. I'm Swedish.
Okay.
Yeah, John, don't just stand there. You need to get that ball
And
out. Do some,
I
you get
teach a
some
slow.
weights.
I teach a slow system of training. We want constant resistance on these muscles, and once we stimulate these muscles to respond, the bones that are attached will respond.
Oh,
it's a
they're
protein
stimulated. Okay. Do I come back down?
Down, nice and slow. Yeah.
Ooh.
Then we can do
Okay.
a press overhead.
Oh, there you
Slow.
go.
Those are nice dumbbells.
You look like
Oh.
you're a YMCA dancing guy.
Right.
Yeah, I think we could use heavier ones. Do a standing press,
Okay.
straight up for shoulders.
Okay. Oh,
Boy, this is one of those.
what a
This
guy.
is one of
Look
those
at that.
deodorant moments.
Actually, the exercise Heidi
Okay.
did was a little more difficult than that.
Now, what do I do? Yeah, thank you very much.
On
You
the
have
ball,
the
we
easy
could do.
one.
We would do a wall squat. We put the ball against the wall and would squat up and down. to use
Well,
the
let's
ball that
squat
way.
on the wall, and
Okay,
then
we'll
we'll
see if-
talk about
okay.
what's next. Hang on. We're
Try
going to
this,
wrap it
Heidi.
up here. Hang
Put
on.
this here.
Oh, geez. I'm working up a sweat, Benny.
Okay. that's
Okay,
part of the
ready?
deal.
No, you have to keep doing the lifting.
keep
You
going,
can't just
John.
sit there.
Okay, now
Okay.
work down. Right about there, and then come back up. Straight up, straight up. Keep your back straight,
Oh,
Heidi.
jeez.
Okay.
Okay.
Well, we want to take these exercises to a point of muscle failure, in other words, so you can't do another good repetition. You have to work these muscles harder than they used to, or else we're not going to get a response.
Yeah, my
All right.
You
muscles
can't
are
just go
failing.
through. How are we doing there, John?
We're doing good.
Okay.
All right, up next,
Okay.
exactly how much you should be bleeding or panting before you go to the emergency department or an urgent care center.
Exactly. Thank you very much. Benny, thank you.
My pleasure.
John, thank you. That was lame.
We'll come back with the gory
Yeah.
details of
Yes.
what to do next on the special edition of Your Health A to Z.
Look at that. Look at that. Whoa.
That's good. On the nose
That
is
worked.
better, Heidi.
Okay, ready? Catch. Okay, you try that. You do that.
I think,
You do that.
yeah.
It's happened to most of us. You get sick or your child is injured, but is it time for an emergency room visit or is urgent care the answer? Believe it or not, there is a profound difference. My co-host, Dr. John Shufeldt. Hi, Guy.
Hello.
How's your calcium going here?
It's excellent. I feel stronger and perkier already.
Good. Well, you work in both environments,
I do.
actually, urgent care as well as ER. And a lot of people don't really know which way to go.
Exactly, and that's one of the things we always see. And for example, at St. Joe's, you'll see people that have waited quite a while because at St. Joe's, for example, a lot of emergency departments, people come there and they're pretty ill, and obviously you want to take them first.
Right.
So a lot of people come there, they have to wait a little bit longer, but they really could have gone to an urgent care center. So let's take a look and see what people are going to have, what people have happened to them at an urgent care.
Okay.
Hi, Tommy. I'm Dr. Holland. Hi. Nice to meet you. So we're checking your eye.
When Tommy injured his eye in a playground accident, his mom had several choices for medical help. She chose a nearby urgent care center.
Urgent cares are great if you can't get in to see your doctor and you have an issue going on, a minor emergency. that's the perfect place to be. That way you don't have to go to the emergency room and wait for hours to be seen, both making it difficult for yourself and other people that may have more urgent matters to be seen right away.
Dr. Gil Holland is one of many board-certified physicians who's decided to make urgent care his specialty because of what it offers him and his patients.
I elected to work in an urgent care setting because I get to spend more time with the patients, get to listen to the patient and talk to them, and spend less time doing paperwork.
There are times when it's hard to decide which way to go, the emergency room or an urgent care. So here's some advice.
We see everything from common colds to an earache to broken bones, people complaining of back pain, people having migraine headaches, and people just not knowing what's wrong with them, but just knowing that they're just feeling ill. I'm going to put a couple drops in your eye. We can do x-rays at the next care setting. We can do EKGs. We can offer basic eye exams as well. We do sports physicals. We do employment physicals. We have a whole array of different things we can offer.
This is Tommy's follow-up visit to make sure his eye is healing properly. So it's a lot like seeing a family doctor without the weeks of waiting.
Coming to Next Care is just like seeing your regular doctor. You will get prescriptions if needed. If there's a broken bone, you'll get splinted. If you have skin that needs suturing up, we'll put stitches in you or staples if need be, and give you the proper follow-up as well.
So everything's healing fine?
Yeah, everything's looking like it's.
Should we continue with the medicine?
Yeah, I would for at least the next to make it a full 7 days.
Okay.
The big niche for urgent care is that it's getting more and more difficult to get in to see your private doc, especially when you're acutely sick. And people need to be able to have a place to be seen, and that's what we offer them here. If it were.
So, you know, the other thing about urgent care, I have to say, the lines sure didn't seem as long. That's the problem with ER. You go there and you wait 4 hours.
Well, actually, sometimes you don't, but a lot of times you wait for everybody who's really sick that comes in. If you have a heart attack or a gunshot wound, you obviously want them to go first.
You have to prioritize.
Exactly. It's called triage, and it really does cost quite a bit less in an urgent care than it does in an emergency department. Now, I know this is probably nothing that you've ever heard about.
What?
Well, you don't know anything about being a stressed out mom, huh?
What, are you kidding? Mother of 3, coworker, caretaker, taking care of you on the show, teaching you how to work.
That's the hard
sorry
part.
About that. Well, actually, it's what we do, John, as women. We all take care of everything. But here's the question. Are we taking care of ourselves? And what happens when you have, all kidding aside, a real crisis on your hands? So we're going to talk to a mom whose child's birthing crisis taught her a whole lot about lessons on how to deal with the tough challenges in life. So don't go away. We'll be back.